Today we are announcing 8 additional cases from yesterday, bringing our total number of positive cases to 113. I would also share some reflection from one of the deaths that occurred last week. We reach out, as you know, as part of our contact investigation, or contact tracing is now kind of the word that you're hearing in the media. So we're often engaged with families on a daily basis who might also be in quarantine with the individual and or not have been able to really be there with that individual. So I want to share this. He was a good husband and father who worked for 20 years for the state of Illinois. He leaves behind 3 children, a wife, and lots of family. He will be greatly missed. So oftentimes we hear about why can't we give additional information? Why can't we share? As we explained, part of this is to understand that this is an illness that is impacting throughout our community. We give you the breakouts every day of the ages. Today's new cases involved anyone in their 20s up through the upper brackets, and so it becomes important to understand it is not discriminating based on age. And yes, higher complications are associated with underlying health conditions. We continue to report on our racial and ethnic breakdowns so that we can better plan and assist in those areas. But again, the other part that really becomes important is to understand it doesn't stay in one house. This disease has traveled. We know that. Many of the individuals are associated with what we call community transmission. They weren't an initial contact to a case. And so every time we reach out to those families, we identify who they've been in contact, where do they go, where do they shop, who do they work with, who do they hang with on the weekends. And so this becomes part of that contact tracing that you're hearing about now and why it's so important. And we do appreciate our cases have been extremely cooperative at very difficult times to help us obtain as much information as we can to protect those that were in close contact with them. And so I want to reach out to them and thank you, because when you get that call from the health department, as you would understand, it's not always the most pleasant call to find out. We need to understand more about the illness. The other thing that I want to talk about a little bit today is over the weekend, you heard the governor talk about alternate care sites. And you heard Rockford being mentioned as a location. First of all, we want to come back. The best place to isolate is your own home. We talk about this day in, day out about your home. I'm always saying part of it is the germs you know, the people you know, the people you're with. But in some circumstances, that's not possible and it's not safe. So we work with sites throughout our community, and the Emergency Operations Center is kind of that background we keep talking about, work to secure what we call alternate housing so individuals can be housed if they have the disease and they need care in the sense of being able to isolate from their family members who they can't be with, or whether it's someone we have to quarantine outside of the home because of the number of exposures, it's not safe for them to remain at home. We have put arrangements in place. We also go through a thorough assessment to find out what that person needs in order to safely isolate and quarantine outside their home. So it becomes, we've heard from some of our hotels, people live in those hotels on a regular basis. If they're at that point, we're very careful about selecting and making sure that people that are COVID positive are in a COVID positive area, and those that are negative and simply under quarantine from other family members, we're working then to make sure that they are appropriately served as well. But understand, if you need that resource, when it becomes identified, we will pull together what we can from our local perspective first before we send someone out of our community, because we understand what resources are available. We understand that people do not want to be sent away or someplace far away from where they know. And our goal is to have them come back out on the other side with us in the community. So that becomes an important distinction to make. So we first look at our local resources and our response. We've worked with our various vendors, hotels, service providers, food distributors, so that we can safely shelter someone in an alternate care site within our community. So again, in those circumstances where someone cannot be safely sheltered in their home, we then take the necessary steps. So as we talked kind of as a wrap up, I think most of you know we're working through this, 8 cases additional today. I'd like to say there were none, but we continue to want to monitor the situation. We continue to monitor where particular hotspots are and where areas of concern have been. And so we will continue to report those. But please understand, we work with every individual, the contact tracing that goes on from their employment, their friends, where they went to, at certain times. So it often involves more than their physical address. And so I often say, will that change your behavior, when you identify an address? And the answer is probably not. Because again, you can't know by just looking at someone, you can't by know the address. It's really understanding how those different contacts they may have had may have been impacted. So I want to thank our community that is really working hard to stay put and really limit their travel outside for essential services. When I hear the mayor talk about the importance of food pantry and pickups for food pantry, and we are working with businesses that want to maintain themselves as being open or essential for very minimal kinds of service. And while I understand it's very devastating to a business, I come back and say, is it really essential? And if you are the individual that's traveling out of your home, is that really necessary? Because again, we have an opportunity here and we continue to work hard to keep that rate of infection from spreading low, but we need everyone in so that on the other side of this, we can come all out and revamp and restore and renew. And our goal is to be in full recovery.